Hi, my name's Deepa and I have multiple sclerosis. I was diagnosed when I was 20 years old. I'm now 36 years old. The reason I'm doing this video is I'm hoping that it will inspire others to treat MS a bit differently, to see the positive side of it rather than the negative. So it all began when I was 19 years old. I started off with optic neuritis, and then that cleared up within a couple of weeks. I went to the Western Eye Hospital, was told there was nothing wrong with my eye, so I couldn't understand why I had blurred vision and a decreased colour vision. A couple of weeks later that cleared up, and then another 2 weeks later started some numbness in my neck that went down to my fingers. Again, that cleared up in a couple of weeks. It concerned the doctors, and I was referred to the Hospital of Neurology and Neurosurgery to have a few tests. I had an MRI, I had some other tests as well, and after finding lesions on the brain, they wanted to have one more test to confirm whether I had MS or not. So I went for a lumbar puncture. Wasn't painful, it was pretty straightforward. They extracted the liquid, did some tests on it, then called me back into the hospital and sat me down and explained MS to me. When they first said multiple sclerosis, I was like, okay, totally oblivious to what it was, how it affects people, what it does to the body. So I left the hospital, I went home, told my parents, obviously before I looked up on the internet and explained the issue, what MS was, because they were totally oblivious as well, didn't know what it was, and I don't think it quite sunk in at first, but anyway, I had MS and I had to deal with it. I was working at Waitrose, and I had a checkout supervisor or assistant position, so I was on my feet all the time. At that time I didn't have no problem. I used to get fatigued quite a lot, but I just thought that's because I possibly worked a bit too hard. Lots of running around and walking around. I didn't actually have any more symptoms for about 4 years. I then started having a sensory relapse, where I couldn't tell the difference between hot and cold. Somebody would touch my legs and I would just scream blue murder because I didn't know the sensation. I couldn't tell what it was, and it would just kind of be painful, but not painful if you get what I mean. The way that I got over that is cleaning, actually. It's strange, but it's very therapeutic, I guess. I was bored at home. I'd taken some time off work and I needed something to do. I was just itching to do something. So I started cleaning the kitchen, emptying out all the drawers. My mum had so much stuff dumped in there. So yeah, just organised it all. This is after about 2 or 3 weeks of having the relapse. So it was just nice to do something else. And before I know it, not even thinking about how I was feeling health-wise, my symptoms had just relieved themselves. I was on some oral steroids, which I do believe helped anyway. And then again, I had no relapse for another few more years. I then started having a bit of a balance issue, and then that cleared up again with steroids. After about my 4th relapse, my doctor, Malik, at Charing Cross Hospital, basically said that I really should go on some kind of drug to help with the relapses. It'd been discussed many times before, but I'd said no. And this time I think I kind of knew that I needed to go on something to prevent any more relapses occurring if I could. So he suggested that we go on Avonex, which is an injected drug, which I have to do myself. Shock horror. I think that's why I said no so many times, because I didn't want to inject myself. He sent over a nurse to show me how it was done. So they got me this soft pad. They showed me how to fill the injector, where to store it, all the rest of it. She showed me how to do it on the injection pad and then said, right, give it a go. So I gave it a go. Seemed pretty straightforward. Next thing you know, she's told me to fill up another one. She goes, right, do it on your leg. Yeah, it's kind of strange, because as frightened as I am of needles, I kind of just did it. Psyched myself up for it, and then in went the injection. After that, it was every week for about 2 years. Avonex is a drug that made me feel really crap for 4 days, and then fairly okay for the 3 days, and then you go through that cycle. I used to do it every Wednesday evening before I went to bed. The symptoms that I used to get from that were horrible. It's almost like flu-like symptoms, really bad headache, achy body, and I think one night I even woke up from my sleep kind of crawling along the walls, trying to speak but not able to speak. I don't even know if it was a dream or not, to tell you the truth. It was after 2 years where I had another relapse. Went back to the hospital and they were like, right, there's a new drug and we want you to go on this one if the Avonex is not suiting you. And this drug is called Tysabri. It's an infusion, so you go into hospital once a month and you have an infusion for an hour, and it was the best thing. Did not like the Avonex where I was injecting myself at all, so this was a blessing in disguise. How I felt on Tysabri when I was on it for 2 years. I was going swimming. I could walk across the road, go up and down the stairs, so much more able to do things. And the fact that I was swimming made me so much more mobile. And I think that contributed to a lot of it. With Tysabri, you do get that power or oomph. And it's something that I haven't felt with the other drug. Tysabri after 2 years. I was then going to try for a baby. In that period of time, I then got Graves' disease, which was a thyroid issue. So I had thyroid problems, and because I was on thyroid tablets, I wasn't able to try for a baby just yet. They said that I should wait and hold off and all the rest of it. So I did for about 6 months to a year, until it was all, I was given the all go. Anyway, I was successful because I have a 10-month-old and she's beautiful. She's very active and keeps me busy. During the pregnancy, I was great. I was working in our cake shop, having fun, going out as normal, doing normal things. The only thing is towards the end, the walking got harder. I did take a few trips and tumbles, but all in all, it was a good pregnancy and I can't complain. After pregnancy, first 3 months, brilliant. Just tired from looking after the little one, but I had lots of help from my family. My sister was amazing. Mum was amazing. It's nice to have family to support you. After the 3 months, she's getting heavier and my walking has deteriorated quite a lot. Can't walk across the road. I get really tight muscles. I'm constantly wanting to sit down, so I'll stand up, do a little something, and then feel so tired and fatigued, and so I'll sit down. I can't get up the stairs without holding on to the barriers. So I've gone from being really able to do everything to kind of not so much, and it is because I push myself quite a lot. I've only just gone back on Tysabri after a long waiting list. I have managed to go back on it. I've had my first treatment. I've also had some steroids a week prior to that. So in a separate vlog, I'm going to tell you how the steroids made me feel. And also keep you updated on how this Tysabri is affecting me. I did have a couple of good days just recently where I was just like, wow, my legs feel amazing, and I was able to do loads. My issue is, and my biggest problem is I can't sit down. And I overdid it that day, so the next day I was back to square one and still feeling rubbish. I hope you found this video inspirational. I guess I'll see you on my next video. Bye!